My throat would get so dry that when I was trying to sleep, I would wake up coughing. The back of my throat would stick together almost. I walk around with water bottles everywhere. Sandwiches are hard to eat. I don't eat crackers very often. You don't eat a lot of salty foods because then your mouth gets dry and you're drinking more water. And it's just a lot to think about all the time. You don't want to get too close to people. It's just kind of embarrassing.
Xerostomia itself is a symptom of dry mouth or decreased salivary flow. Saliva is very, very important to the health and integrity of the oral cavity. When saliva is diminished, either in quantity or the composition of saliva changes somewhat, then the person becomes very, very susceptible to a number of different oral problems.
So I start the conversation around dry mouth with my patients by addressing a lot of things that I think might be impacting them or suggesting things that might be going on at home that maybe they're not even aware that they're doing. You try and look at the body system, see what's happening there as far as any medical conditions like Sjogren's, or had they had head and neck radiation in the past.
The common causes of xerostomia are primarily medications. The lesser causes are Sjogren's syndrome, which is an autoimmune connective tissue disorder similar to rheumatoid arthritis, but also can occur with lupus or fibromyalgia, other connective tissue disorders. But the most prevalent is medications, and there are a number of medications, including antidepressants, sedatives, tranquilizers, anxiolytics, diuretics for blood pressure, beta blockers, antihistamines.
And you start feeling something's wrong with you before you start realizing that there's something that's causing it to happen. But then when you try to remove what's causing it to happen, it's hard to do that too. I've got diabetes, so I have to take my medicine. If there was a solution, I would be really appreciative. I'd be able to relax more. I'd be able to feel free around people, be with my grandchildren more.
The advice that I would give would be to not wait until the devastation has occurred. Obviously, the earlier we can intervene, the better the outcome will be for the patient's overall oral health.
It's time to change the conversation about xerostomia. 3M can help. Introducing 3M brand Xerostomia Relief Spray, a professional-grade prescription solution designed to provide rapid, effective, and convenient relief of xerostomia symptoms. It's simple to use, and patients can apply it wherever they are, at any time of day. In a clinical study, 92% of patients saw an improvement in their dry mouth symptoms. It's time to speak up